Hi guys, my name is Jolie Hensley and I'm going to be showing you my proposition to fix the lack of transparency in our healthcare systems today. So what is actually the problem? There's a severe lack of transparency within the healthcare field. Some examples include just prices of doctor's visits or hospital visits, prices of medication, and procedures. Some of the procedures the patients don't even need these procedures, and they're being told that they need them. So there's sort of a lack of trust there, and that transparency that the doctor is not showing the patient, whether it's giving the procedure that's unnecessary or whether it's giving medications that are unnecessary, and also not being upfront about the prices of the visits or any other prices regarding to their stay or what they're being treated for. Patients feel as if they cannot trust the people who are supposed to care for them. Like I just stated, there's that lack of trust and that lack of bond between the caregiver and the patient. If they feel like they're being lied to or they're not being upfront with, they feel like they cannot trust this caregiver, and whatever they're saying is they're lying, especially if it's about prices. If they're not looking to really help their patient or help their situation and their condition, they're just looking to make money. They feel like it's sort of just a lack of trust and they don't really care for them at all. And patients do not receive thorough information about their care. They are given some information, whether it's due to their condition or something like that, but they're not given enough information, such as exactly chart data. The doctors may see the chart data, but not all patients can see that, and they don't really understand what's going on, whether the doctor prescribes a new medication. They're not really sure or told what it's for or how it's going to help you. And, sorry, it's my dog. It's not really going to help you. And they're sort of just left hanging and left without complete understanding of really what they're getting into when they go to the hospital or even to a doctor's visit as well. So attempted solutions. There have been very few solutions. The things that I've researched, they were sort of kind of the same and still having to be acted on, because there's still, even today, there still is that lack of transparency. It's still happening today. So the first thing is that there has been a lot of added pressure on insurance companies and hospitals, and also that pressure for them to work together as well. That has been added on severely because they need to try and work with other patients' insurance status and things like that. So that added pressure has come to try and offer lower price options. So that has helped some when they can reach a lower price option for that patient. And some hospitals offer quality data of their care to see what the patient actually needs. So not only is the doctor and the hospital have record of that care and that data, the patient can also see now what exactly they're getting, what medications they're getting, what they're for, what procedure they are recommended, and how it's going to help them. If it's going to better their condition or worsen their condition, it's going to help them overall. So that chart data can really improve the organization of the hospital, and it can give peace to the patient's mind as well. So my proposition, I have 3 steps to improvement. The first one is to improve access to data for patients and doctors, whether this be as soon as they walk in, they see their chart data of maybe their visit a year ago or 2 years ago, or their past medication that they don't remember if they were allergic to or they had a bad time with. So, and then they can see their records of what is recommended for them to be going through next, and the doctors can also have that as well. So that can really help within the organization and also to put the patient's mind at ease. And the second one is to have a high medical have a medical professional review the report that the doctor has given their patient. When a doctor comes in and they're, collecting all the symptoms of the condition of whatever the person is going through, and they say maybe this person needs XYZ medication or this procedure, there's going to be a higher medical professional who will review this and say, I don't think that procedure really goes along with what they're going through. They can also come back in and review the patient theirself and go along with what the doctor has already put in the chart and go back over it with the patient and listen to what they have to say to make those conscious decisions. And the third is to set a high standard for the medical staff. When you set a higher standard for the people to work in your hospital or in your doctor's office, it's going to make a big difference. I know doctors they make a lot of money, so it's great to have that money as a reward, but you don't want people who just are in it for the money and are sort of in it to, sort of get out and get that money. As for my experience with my grandmother, we had a doctor who just sort of was in there quick and get out. They weren't really here to listen to the patient or listen to what they were going through and what their condition was. It was just sort of, mark the check boxes and then head out. And it just seemed very rude, and it also created that lack of trust and that bond that was sort of missing that should be between a caregiver and a patient when the patient is seeking medical care. So why is my proposition a good solution? By no means will this solution solve all of the problems in the healthcare field, because I'm sure there are better solutions out there. But the first thing is that it will help with the organization of the data with the doctors and patients. It can just have everything sort of have your ducks all lined in a row. The second thing is that hospitals will benefit because it can help cause less problems with patients and their families and will save more money for the hospital as well. The problems include if the person receives a procedure that ends up causing another condition or another type of damage that they didn't come in with, and that procedure wasn't really needed. There have been lawsuits against that hospital. And that's something that hospitals don't really need just to save money. And so it can solve those problems between families as well. And it can save the hospitals more money. The way it can do that is because when you assign procedures, they cost a lot of money to complete those procedures and things like that, and also medications. So it's going to save the hospital a lot of money and sort of dial down the problems with the patients and the hospital. And it can also offer new jobs, such as the medical supervisor over the doctor's reports. I'm sure they have something like that. I'm not really positive, but it can create new jobs to where the person who comes back in sort of over the doctor who is in charge of that patient sort of comes back in and reevaluates their statement to make sure everything is right. So the feasibility with this plan is that price transparency is easier to get passed at the state level than it is at the federal level of legislation. So you would have more luck going with the state-based efforts than you would at the federal level. So the state level efforts would be more feasible to help with this solution and this proposition. So the call to action is that hospitals need to have a higher expectation for their staff. The hospitals can't just keep hiring people, who are just in it for the money, and you have to have a real passion to care for these patients to really try and help them be on the same page and try and get them to trust you as well. And hospitals need to be willing to work with patients and their insurance status. Not everyone has the best insurance or a lot of money, and they need to be willing to work with everyone's price range and just to hear them out as well. And also, the main and the big thing is being honest and upfront with the patients. This includes prices about needed procedures or unnecessary procedures and medications and even doctor's visits as well. So they just sort of need to be upfront and with what's going on, because some of the unnecessary procedures and the medications can lead to addictions and drug problems to those prescribed medications, and those unneeded procedures can end up making lifelong changes and trauma for that patient if something ends up going wrong and changes in the condition that they did not need. Thank you guys so much, and I hope y'all have a great day. Thank you.